Hi, I'm Greg Dell with Dell Disability Lawyers, joined by attorney Rachel Alters. And in today's disability tip video, we're going to talk about long COVID disability claims, or also known as long haul COVID disability claims. And we're doing this video in the middle of 2023, so COVID's been around for a better part of 3 years now, and we're about to see the national pandemic of COVID being told that it's over, I guess,
Right.
and all of the restrictions are basically gone. But now what we're seeing a lot of, especially as a long-term disability insurer representing claimants all over the country, is we're seeing a lot of long COVID disability claims that are coming to us, and we've represented many, many people already with this condition. And I think it's only going to continue to multiply because we're seeing more medical research being done on the topic, and more and more people having different symptoms and limitations that they don't know if it's long COVID or was it related to something else, but they're chronic. And
Right.
that's what the problem is that these are chronic medical conditions that from when people got diagnosed and thought they were going to get better, they haven't got better.
Correct.
So in this video, I'd like to provide some tips for people who are seeking benefits, might be on claim already for COVID, and give them guidance so that they can get these benefits if they need COVID. One of the, if they not need COVID, if they need disability.
Yeah.
One of the, well, let me ask you this. What are the biggest challenges that you're seeing for people that are seeking disability for long COVID?
Well, the challenges have changed over time. So when COVID obviously first came around and people started getting sick, and then after they started testing negative, they realized they still were feeling terrible. The insurance carriers really weren't recognizing it because long COVID wasn't really a thing. They weren't familiar. It was all new. So it was kind of like an education process that, we had to educate the insurance companies about what long COVID was and that it really is a thing. It's been getting better, meaning the insurance companies are now recognizing that long COVID does exist, that there's a lot of different symptoms. And, they could go from fatigue. Some people just can't seem to get rid of the severe fatigue that they have on a daily basis, and some people have lung issues that haven't resolved themselves. So, and if you had pre-existing conditions before you got the COVID, whatever your pre-existing conditions were at the time have gotten significantly worse. So if you had, if you were prone to diabetes,
Right.
you would end up diabetic. And I have a lot of clients who have cognitive issues, and it's like a brain fog, and they can't concentrate. They're not able to multitask anymore. I have an emergency room physician who ran an entire emergency room, and he got COVID, and after that he was never the same. He couldn't do what he used to do. He couldn't take care of patients. He couldn't run an emergency room and be in 10 places at one time because he couldn't focus, he couldn't concentrate. And he's had multiple neuropsychological evaluations that have shown that he's got cognitive issues, and never had he had any of these things before he got sick with COVID. So it's an education process, and it's also every claimant and every person is different. Their symptoms are not the same.
And what category do you see this long COVID falling into? Does it seems to manifest itself like a lot of our clients who have like the autoimmune disorders?
Right.
Is that where you would put the classification? Is that how disability carriers are looking at this?
Yeah, I mean, they look at it as, as something. It depends, because some people, with an autoimmune disorder that have long COVID are severely affected. They get pain in all of their muscles, and they're weak and all of that. So they kind of do categorize it like that. But the people who have the lung conditions or breathing issues, sometimes it's categorized a little bit differently. It's different from claimant to claimant.
Where do you see this long COVID is going to shake out in terms of limitations and policies when they talk about like musculoskeletal or subjective complaint limitations? Is this long COVID going to fall into the subjective category, or is it going to be a physical diagnosis of long COVID, and there won't be any conversation about this being a subjective, basically, limitation?
Right. Well, I think again it's different with each patient, because some people, some of our clients, have issues that aren't objectively able to be tested. So if it's, fatigue, you can't really test that. So that could become a limitation, and part of one of the limitations in these policies that say that they're going to pay 24 months only for any subjective complaints, including long COVID symptoms that aren't provable with objective testing. Now I have some clients who have pulmonary issues and their pulmonary function tests, they're failing them, and they're short of breath all the time. They have heart issues. I have a couple with actual heart complications, and these are measurable by objective testing. So I think the insurance companies may start getting creative with them, because there's no telling in how long these long COVID symptoms are going to last. So they could last a lifetime. They could dissipate in a year. You just don't know.
But I think long haul COVID, and we don't know yet, and I haven't seen any policies yet that say limitations for COVID, but look at COVID in the sense of, unlike a fibromyalgia or a chronic fatigue, where you don't necessarily know the etiology, meaning where did it come from? It's kind of like a diagnosis of exclusion.
Right.
Long haul COVID is not a diagnosis of exclusion, because all of these people at some point had a positive COVID test.
Right.
They were infected by a virus, in the same way that maybe many of your clients who have Lyme disease. We know that many of them had a tick bite. Like, we know the source of where it came from. So I think, and we haven't had to make these arguments yet, although we're anticipating them, to say, like, no, this is a physical condition. We know it happened. There was this event that took place, whether even if someone had a bacteria infection or whatever, but this was a virus. Person was physically infected, and now these are all the symptoms they're having. Right. Symptoms are always subjective, even if someone breaks their arm. Yeah, we see the objective diagnosis on the X-ray or the MRI, but whether or not that person's in pain or not is totally up to that person.
Exactly.
So I think long-haul COVID should always be a physical characteristic. Now, does that mean disability carriers writing policies right now aren't going to say, and including, long-haul COVID is going to be limited to 24 months?
Sure.
We may start seeing that.
Yeah.
With the long haul, what type of treatment do most of your clients receive, and what types of doctors should they be treating with?
Right, and I've discussed this with many of my clients, because obviously the physician you're treating with has to be specific to the symptoms you're feeling. So for my doctor, he's got a pulmonologist that he's seeing because he's having issues with breathing and shortness of breath and his lung function. So he's treating with a pulmonologist regularly. He's also got a neurologist who's been dealing with the cognitive issues that he's been having, because he's having a hard time focusing and concentrating, and it drives him crazy, because his whole life, he was able to do all these things, and he was, when you manage an emergency department and you're on top of the world and you could do everything, and then, you get sick and then none of that's working, it's very frustrating, and they also suffer from depression and anxiety, because a lot of these long haul COVID patients, for them, it's very frustrating and depressing that they can't do the things they used to be able to do when they have a ton of fatigue. So they usually follow with their primary care doctor on a regular basis. Then they go out to the specialist, depending on what their, if it's diabetes, they've got an endocrinologist that they have to follow. And I tell them, please make sure you're going to see them at least every 2 to 3 months, so that we have records to reflect that, hey, you haven't gotten better yet.
So it sounds like what you're saying is that you're going to have a primary care or an internist who's going to be like your quarterback.
Right.
And then that primary care doctor can document all of your complaints, but really based upon what's going on. And it seems like the symptoms and complaints that we're seeing from long-haul COVID patients is that they're broad.
Right.
And because of that, you can go to many different specialists. So we're not necessarily seeing, well, that's a long-haul COVID doctor who only does long-haul COVID, because it can be as wide as, like you said, pulmonary issues to depression, to an exacerbation of a pre-existing condition. So it's and fatigue, so it's a very wide range. So basically that's why you go to a general medicine internist or a family medicine doctor, and then let them send you out to the specialist. So most of your long-haul COVID clients then are having multiple doctors, I would assume.
They are. I have one also with vision issues now, blurry vision. So that's another thing, and they're dealing with an ophthalmologist. So.
And then for people with long-haul COVID, and I kind of know the answer you're going to give already, but how often do you think they should be seeing, at a minimum, their primary care doctor?
I would say at least every 3 months.
Okay.
That's usually my advice. So sometimes they can wait as long as 6 if they're seeing specialists in between.
So I find the long-haul COVID claims, they can be difficult, because the disability carriers are like, what's going on here? You had this condition, but 98% of the people who had this condition got better, and why do you still have these symptoms?
Right.
And I think that's the million-dollar question for all of these people, but the reality is that they do have them, and you have to deal with it. So the best thing for people with these long-haul COVID is when you go to the doctors, you better make sure you're documenting all of your symptoms, everything that's going on, every limitation you have, because the claim is only going to be as good as the strength of your medical records.
Exactly.
Well, if you're someone who's been suffering with long COVID, feel free to reach out to Rachel or myself. No matter where you live in the country, we're available to assist you, and we'll always provide you with an immediate free phone consultation to discuss your long-term disability claim.